Hello students, my name is Advika, and in this video we'll be reviewing about anxiety disorder. So anxiety, we often heard that, right? It's a complex yet mysterious feelings, and the more we learn about it, the more perplexing it seems. And anxiety here is a specific type of disorder that we will discuss about it, but it is actually more than that. So it is an emotion implicated so heavily across the psychopathology or mental disorders. And before we learn more about the classification and the symptoms of anxiety disorders, could you differentiate between fear, panic, and anxiety? So these three emotion closely related to anxiety disorder. First of all, fear. I believe that we all have experienced fear. So actually it is a mechanism that will save us from danger. Yeah. And it is a sudden reaction that occurred because we have that mechanism that is coordinated by the sympathetic branch of our autonomic nervous system, right? And that allow us to react to a dangerous stimulus. So let's say a poisonous snake. By developing a fear, we're activating our autonomous nervous system, and that trigger us to run from that dangerous stimulus or to fight it in order to be able to save our life. And the next one is anxious. Have you ever felt anxious? Of course. Most of us feel some degree of anxious in our everyday life, and actually it is a negative emotion, negative effect that characterized by bodily symptoms. And fear is an anticipation of sudden dangerous situation, but anxiety here is more likely an anticipation of future threat here. So that's the basic difference between the two. And the characterized behavior of anxiety could be anxious, worry, nervous, and it also following by changes in our body reactions such as tension in our muscles, increasing heartbeat rate, sweating, and etc. And what about panic? So panic is about like a sudden overwhelming reaction with no actual dangers, yeah? And panic attack is defined by an abrupt experience of intense fear or acute discomfort. And it's also accompanied by physical symptoms such as heart palpitation, chest pain, shortness of breath, and even dizziness. So they can be unexpected or expected or in a specific situation. So let's begin by investigating the etiology of anxiety disorder. All right, so we actually inherit a tendency to be anxious, right? To feel tense or uptight in our body. However, this genetic vulnerability does not cause anxiety or panic directly. Stress or other factors in the environment that will turn on these genes, right? So this genetic cause of anxiety disorder include our brain circuit and neurotransmitter. So the corticotropin releasing factor, or the CRF here, activates the hypothalamic pituitary adrenocortical, or the HPA axis, yeah? So this CRF system has wide range effects on the areas of our brain that implicated anxiety, including our emotional brain, yeah, our limbic system, particularly the hippocampus and the amygdala, as well as the locus coeruleus in the brainstem, and as well as the prefrontal cortex. All right. Also, including the dopaminergic neurotransmitter systems. Here, the CRF system directly related to the GABA or benzodiazepine system. And next to the biological contribution is a psychological contribution that can be caused by the parenting style. So the sense or lack of control develops from our early experiences that makes us more or less vulnerable to anxiety. And this might contribute by how our parents raise us. And also we develop an anxiety sensitivity or the general tendency to respond fearfully to anxiety symptoms. And social here also contributing to social anxiety disorders. So stressful life events that trigger our biological and psychological vulnerabilities to anxiety, right? And those social contributions include marriage, maybe, or divorce, or difficulties at your work, or death of a loved ones, or pressure to excel in school, and so on. And some also might be physical, such as injury or illnesses that will trigger our anxiety. Based on, according to DSM-5, there are 8 types of anxiety disorder, and we will check them out one by one. The first one is the separation anxiety disorder. Is one of the disorders that until recently was identified more closely with children. And separation anxiety disorder is characterized by children's unrealistic and persistent worry that something will happen to their parents or other important people in their life, that something will happen or something will happen to the children that will separate them from the parents. For example, that there will be lost or kidnapped or killed or hurt in an accident. So these symptoms often make the children refuse to go to school or even to leave their house. Not because they're afraid of the school, but they're afraid of separating from the loved ones, okay? That will also sometimes cause nightmares that characterized by involving a possible separation with their parents. Okay? And all young children actually experience separation anxiety to some extent, but this fear usually decreases as they grow older. Therefore, a clinician must judge whether the separation anxiety is greater than would be at that particular age. All right. It is also important to differentiate between separation anxiety and social phobia. So in school phobia, the fear is clearly focused on something specific to the school situation, that the child can leave the parents actually or other attachment figures to go somewhere other than school. While in separation anxiety, the act of separating from the parents, it will provoke the anxiety and the fear. And the treatment of separation anxiety disorder in children by psychologists or psychiatrists, the parents are often included to help to structure the exercises for the children, and also the psychologists would help the parents to address parental reaction to the anxiety of their children. All right, the next one is the selective mutism. It's a rare childhood disorder characterized by a lack of speech in one or more settings in which speaking is socially expected. So it seems clearly driven by social anxiety, since the failure to speak is not because of a lack of knowledge of speech or any physical difficulties, nor it is due to another disorder in which speaking is rare or can be impaired, such as autism spectrum disorder. In fact, speech in selective mutism here commonly occurs in some settings, such as schools, but not others, such as home. So here, why the selective terms is used. All right, so in order to meet the diagnostic criteria for selective mutism, the lack of speech must occur for more than 1 month and cannot be limited to the first month of school, because that's including the adaptation time for children. And further evidence that this disorder is strongly related to social anxiety, right? Because it found the high rates of comorbidity between a selective mutism and social anxiety disorder. And treatment for selective mutism usually employs many of the same cognitive behavioral therapy that is used successfully to treat social anxiety in children, but with more emphasis on the speech. All right, the next anxiety disorder is specific phobia. So it is an irrational fear of a specific object or situation that markedly interferes with an individual's ability to function. So in earlier version of the DSM, this category was called simple phobia to differentiate with agoraphobia, but then we recognize there's nothing simple about it. Right? So the DSM-5 criterion of social phobia here is the marked fear and anxiety about a specific situation or object, and the fear of and anxiety were out of proportion, and also this this makes the patient will avoid the situation in which their phobia or their phobic response might occur. And the subtype of specific phobia, including fear of certain animals, environment, blood, injuries, and situation. And the fifth one is the others. It's include phobia that do not fit any of the four major subtypes. For example, situation that may lead to choking, of vomiting, or contracting an illness, or maybe in children, avoidance of loud noises and costume characters. All right. So we thought that most specific phobias begin with unusual traumatic events, right? So that's the simple explanation. For example, if you're bitten by a dog, then you would develop a phobia of dogs, okay? But this is one way of developing phobia, and this is true, but there are at least three others there. The first one is traumatic conditioning experience. Here often also plays a role. So even when you're just hearing about frightening event, it's sufficient enough for someone to develop phobia. And the second, fear is more likely to develop if we prepare. That is, we seem to carry an inherited tendency to fear situations that have always been dangerous to human race, such as being threatened by wild animals or trapped in small places. And the third one, we also have to be susceptible to developing anxiety about the possibility that the event will happen again. Okay, so and then the last one is the social cultural factors are also strong determinants of who developed and report a specific phobia, because in some society, it is almost unacceptable for males to express fears and phobia. That this overwhelming majority of reported specific phobias occurs in women. All right. So the next anxiety disorder is the social anxiety disorder, or social phobia. So we must remember that social anxiety disorder is more than exaggerated shyness, right? So according to DSM-5, S80 diagnosis criteria should be the client should experience marked fear or anxiety that focus on one or more social or performance situation. And people with SAD have excessive worry about being embarrassed or humiliating in front of public, right? Those they tend to avoid public because of that. And those symptoms should persist at least for 6 months. So SAD usually begins during adolescence with a peak age of onset around 13 years. And it also tends to be more prevalent in people who were young, 18 to 19 years. Who are undereducated, single, and low socioeconomic class. So we have noted that we seem to be prepared for evolution to fear certain wild animals and dangerous situations in natural environment. But similarly, it seems that we also prepared to fear angry, critical, or rejecting people. So why should we inherit a tendency to fear angry faces? Why? Because our ancestor probably avoided hostile, angry, domineering people who might attack or kill them. So in all species, the dominant, aggressive individual and high in the social hierarchy tend to be avoided. Okay, so possibly individuals who avoided people with angry faces were more likely to survive and pass their genes down to us. But then, of course, this is just a theory, right? So another explanation, so traumatic social experience may also extend back to difficult periods in childhood. So usually early adolescent, usually ages 12 to 15, when they experience a bullying or brutally taunted by peers who are attempting to assert their own dominance. And this traumatic experience may produce anxiety and panic that are reproduced in future social situations. Right. So comorbidity occurs with other anxiety disorders. Here include depression and substance abuse disorder. So because other anxiety disorder can accompany social anxiety, and social anxiety can lead to depression due to the loneliness, the isolation, and inability to make social contacts. Moreover, people may use drugs or alcohol in an effort to reduce their anxiety in social situations, right? And that makes sense. So there are numbers of rules out that the clinician must consider to arrive at an accurate diagnosis for SAD. So shyness and introversion are within normal limits, right? It's personality characteristic, which may be misconstrued as social phobia, while it's not actually. And agoraphobia, of course, it's a more like a more phobia of open space, uh, uh, and it has different etiology, right? And GAD, of course, is more like global anxiety about multiple stimuli. It's not about social. And PTSD, so the social isolation and withdrawal component of PTSD could be misdiagnosed as social anxiety disorder, whilst it's different between PTSD and SAD. And other social specific phobias, also depression, it could be misinterpreted as SAD. And the treatment for SAD, it seems that CBT is still the #1 therapy for anxiety. Yeah, with emphasis on exposure here can reduce the symptoms of social phobia. Exposure therapy here often involves gradually placing oneself in anxiety-provoking situation and associating the feared stimulus with a response of relaxation of indifference. This is also often called as systematic desensitization, and it is very effective evidence-based treatment of phobia, including social phobia. And the next social anxiety disorder is the panic disorder, in which individuals experience severe unexpected panic attack, and they may think that they're dying or otherwise losing control, and accompanied by physical symptoms also, of course. And according to DSM-5, someone diagnosed with panic disorder must have at least unexpected panic attack and followed by persistent concern, worry about having additional panic attack, okay? Or they might also develop maladaptive changes in behavior related to the attack, okay? And the treatment for panic attack include, of course, drugs, medication, exposure therapy again, anxiety coping mechanism, and panic control treatment, where the therapist attempts to create mini panic attack in the office by having the patient exercise to elevate their heart rates, or perhaps by spinning them in chairs to make them dizzy. All right, the next anxiety disorder is agoraphobia, which is fear and avoidance of situation in which a person feels unsafe or unable to escape to get home or to the hospital in the event of their developing panic or panic-like symptoms, okay? The agoraphobia might cause someone unable to leave their home, sometimes for years or more than that. So because the sign or the symptoms are they experience fear, anxiety in these two or more of this situation here, yeah? And they have the thoughts of no escape, no help available, and thus they always have to be, they always avoid the situation by not leaving their home, for example. And these symptoms also should persist at least 6 months, yeah? And of course, causing distress and impairment in the patient. All right, and the next one, the next anxiety disorder is the generalized anxiety disorder. So I believe that most of us feelings worry to some extent, but as we have said before, that worry can be useful. It helps us to plan our future, right? Make sure that everything is prepared for the task, or double check that we've thought of everything before we head home for the holidays, for example. But what if you worry indiscriminately about everything, like literally worry about everything? It could be a generalized anxiety disorder. So the diagnosis criteria of the GAD, so the symptoms here of the excessiveness and of worry and fear should be there at least for 6 months, right? And having at least 3 of these following symptoms. at least 3: restlessness, being easily fatigued, difficulty concentrating, irritability, and so on. And GAD may accompanied by physical symptoms. Yeah, most likely people with GAD also have muscle tension or discomfort of gastrointestinal or even diarrhea, sleep disturbance, restlessness, fatigue, irritability, and edginess. Okay. And people with GAD often also suffer from depression because it's comorbid with depression, or also bipolar or a substance abuse disorder and insomnia. And treatment, people with GAD still including CBT as the most evidence-based, effective evidence-based treatment for anxiety disorder, as well as self-monitoring, relaxation training, including mindfulness, worry exposure or exposure therapy, and of course, drugs treatment. And that's all about anxiety disorder. Thank you so much for your attention, and I will see you again in the next module.